Welcome to another episode of Med Madness. In today's episode, we'll be discussing a crucial and sensitive topic, the ethical use of opioids in end-of-life care. This is a significant aspect of medical practice that every medical student and healthcare provider must understand. Understanding how to manage pain effectively and ethically in patients with terminal illnesses is vital. It not only alleviates suffering, but also ensures that patients have a dignified and comfortable end-of-life experience. We will cover the principles guiding opioid use in hospice care, the doctrine of double effect, the timing and adjustment of opioid doses, and the management of adverse effects like respiratory depression. To illustrate these points, we will also present a brief real-life case study at the end of this podcast. Let's dive in. Next, let's discuss the current situation in end-of-life care. Patients with end-stage malignancy often transition to hospice care, where the primary focus is on maximizing comfort rather than extending life. Pain control becomes a critical component of this care. When patients experience inadequate pain control despite current morphine dosing, adjustments are necessary. However, this often brings concerns about sedation and respiratory depression, such as respirations dropping below 12 per minute and hypoxemia. The doctrine of double effect is a fundamental ethical principle in end-of-life care. It justifies interventions that may have adverse effects if they are intended to promote the patient's well-being or provide a comfortable death. For example, increasing the morphine dose despite sedation and respiratory issues is appropriate in terminal illness to ensure comfort. Morphine dose adjustments can be made as early as 8 hours after the last dose adjustment, as this is the time required to reach a steady state. Waiting longer, such as another 48 hours, can lead to unnecessary suffering, which should be avoided. In cases of respiratory depression, it might be tempting to administer a reversal agent like naloxone. However, doing so can precipitate acute opioid withdrawal, causing needless suffering and contradicting the patient's goals of care. This is in contrast to the management of chronic pain in non-terminal illnesses where serious adverse effects would necessitate opioid dose reduction and alternative pain control methods. Consider a patient, Mr. J, a 70-year-old with advanced cancer who has been transitioned to hospice care. Despite his current morphine regimen, he continues to experience severe pain. His respirations are noted to be less than 12 per minute, and he shows signs of hypoxemia. Given the principles we've discussed, the healthcare team decides to increase his morphine dose. Despite the risks of further sedation and respiratory depression, the primary goal is to alleviate his pain and ensure his comfort in his final days. This decision aligns with the doctrine of double effect, prioritizing his well-being and allowing for a peaceful end-of-life experience. To summarize, the ethical use of opioids in end-of-life care focuses on maximizing patient comfort, even if it involves potential risks such as sedation and respiratory depression. The doctrine of double effect supports this approach, emphasizing the importance of the patient's well-being. We encourage you to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards we've provided. These tools are designed to reinforce your understanding and help you retain the key points discussed in this podcast. Thank you for tuning in to Med Madness. We hope this episode has provided you with valuable insights into the ethical considerations of opioid use in hospice care. Stay tuned for more informative episodes.